Shet Jewelers and Diamond House. Beyond limits. Women redefining success.
ನಮಸ್ಕಾರ ವೀಕ್ಷಕರೇ, V4 ನ್ಯೂಸ್ ಮತ್ತು ಶೇಟ್ ಜುವೆಲರ್ಸ್ ಆ್ಯಂಡ್ ಡೈಮಂಡ್ ಹೌಸ್ ಪ್ರಸ್ತುತಪಡಿಸುವ ಬಿಯಾಂಡ್ ಲಿಮಿಟ್ ವಿಮೆನ್ ರಿಡಿಫೈನಿಂಗ್ ಸಕ್ಸಸ್ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ. ನಾನು ಅಶ್ವಿನಿ ಅನುಷ್. ವೀಕ್ಷಕರೇ, ಪ್ರತಿ ವಾರ ನಮ್ಮ ಜೊತೆ ಹೊಸ ಹೊಸ ಅತಿಥಿಗಳು ನಮ್ಮ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಇರ್ತಾರೆ. ಅಂತೆಯೇ ಇವತ್ತು ನಮ್ಮ ಜೊತೆ ಇರುವಂತಹ ವ್ಯಕ್ತಿ ಸಾಧನೆಯನ್ನು ಮಾಡಿದಂತಹ ಮಹಿಳೆ ಅಂತಲೇ ಹೇಳ್ಬೋದು. ನಮ್ಮ ಜೊತೆ ಇರುವಂತಹವರು ಡಾಕ್ಟರ್ ಸ್ವಾತಿ ಅಡಪ ಅವರು, ದಂತ ವೈದ್ಯರು ಆಗಿರುವಂಥವರು. ಆರೆಂಜ್ ಡೆಂಟಲ್ ಕ್ಲಿನಿಕ್ ಕುಲಶೇಖರದಲ್ಲಿರುವಂತಹ ಆರೆಂಜ್ ಡೆಂಟಲ್ ಕ್ಲಿನಿಕ್ನಲ್ಲಿ ಇವರ ವೃತ್ತಿಯನ್ನು ಮಾಡ್ತಾ ಇರುವಂಥವರು. ಬನ್ನಿ ಇವರಿಗೆ ನಾವು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತಿಸೋಣ. ನಮಸ್ತೆ ಮೇಡಮ್, ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ.
ಥ್ಯಾಂಕ್ ಯು
ಮೇಡಮ್. ನೀವು ಕಳೆದ 10 ವರ್ಷಗಳಿಂದ ಈ ಒಂದು ಡೆಂಟಲ್ ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ.
ಕರೆಕ್ಟ್.
ಸೊ ಬೇಸಿಕಲಿ ಎಲ್ಲಿಂದ ಮೇಡಮ್, ನೀವು ಯಾವ ಊರಿಂದ? ನೀವು?
ನಾನು ಬೇಸಿಕಲಿ ಫ್ರಮ್ ಆಂಧ್ರದಲ್ಲಿ ಗ್ರಾಡ್ಯುಯೇಷನ್ ಮಾಡಿ ಮತ್ತೆ ಪೋಸ್ಟ್ ಗ್ರಾಡ್ಯುಯೇಷನ್ಗೆ ನಾನು
ಮಂಗಳೂರಿಗೆ ಬಂದಿರುವಂಥವರು ಅಂತ ಹೇಳ್ಬೋದು. ಎಸ್, ಬೇಸಿಕಲಿ ಆಂಧ್ರ ಪ್ರದೇಶಲ್ಲಿ ಇದ್ದು ಅಲ್ಲಿ ನಿಮ್ಮ ಒಂದು ಪದವಿಯನ್ನ ಮಾಡಿ ಈಗ ಉನ್ನತ ಶಿಕ್ಷಣಕ್ಕಂತ ಹೇಳಿ ನೀವು ಮಂಗಳೂರಿಗೆ ಬಂದ್ರಿ. ಹೇಗೆ ನೀವು ಕನ್ನಡ ಮಾತಾಡ್ತೀರಾ ಮ್ಯಾಮ್ ಇಷ್ಟು ಸುಲಭವಾಗಿ?
ನಾನು ಪೋಸ್ಟ್ ಗ್ರಾಡ್ಯುಯೇಷನ್ ಮಾಡುವಾಗ ಇಲ್ಲಿ AB ಶೆಟ್ಟಿಯಲ್ಲಿ ಮಾಡುವಾಗ ಪೇಷಂಟ್ಸ್ ಹತ್ರ ಮಾತಾಡಲಿಕ್ಕೆ ನಾನು ಹೊಸಡದ ಸ್ಪೆಷಲಿಸ್ಟ್. ಸೊ ನಾನು ಸರ್ಜರೀಸ್ ಮಾಡೋದು ಅದೆಲ್ಲ ಮಾಡೋದು. ಸೊ ಪೇಷಂಟ್ಗೆ ಕಾನ್ಫಿಡೆಂಟ್ ಇರಬೇಕಂತ ನಾನು ಆವಾಗ ಕನ್ನಡವನ್ನು
ಕಲಿತೆ. ಮ್ಯಾಮ್, ಮೈ ಐ ನೋ ಯುವರ್ ಕ್ವಾಲಿಫಿಕೇಶನ್? ಮ್ಯಾಮ್, ಯು ಸೆಡ್ ದಟ್ ಯು ಹ್ಯಾವ್ ಡನ್ ಯುವರ್ PG in AB Shetty. May I know where?
I have done periodontics and implantologist. So it's a 3 years course I have done, and I have done my internship also in AB Shetty only.
Okay. So as you said that when you have done your post-graduation, when you are pursuing your post-graduation, you had a very difficult time, you said. May I know what is the difficult period?
I wouldn't say it is difficult, but it was rather challenging.
Yes.
Very challenging. But
may I know why it is challenging and what is that challenging pace you have done?
Yes, actually I was married and I had a kid, 2 years old kid. Then I was pursuing for my PG. I was giving entrance exams and all, but then I got my PG seat. I was quite happy. Then I got to know that I have conceived. I am pregnant with my second child. Then I didn't wanted to drop my PG. I didn't wanted to drop my kid also. So I chose both. Yes. So then it is a challenging path, but I chose it myself. So I was ready to face the consequences, whatever it is. Then that journey, my 3 years journey with my kid, was a difficult thing.
Yes, you had, whether you had a year gap after your UG?
Yeah, UG, after my UG I have a couple of years gap because my marriage and then my kid, elder kid, I was at home only. I was trying to get my PG seat and all, but then in 2014 I got the seat in AB Shetty.
Okay. When you got your seat in 2014, how old was your first kid?
She was 2.5.
Oh,
actually,
so
2
you
years
had 2 roller coasters.
Yeah.
How was your experience during that time?
See, actually, I was pregnant and then I joined my elder one in a play school, and then I was daily morning 8:30. I have to report at college. So I have to drop my
attend
child.
As a regular student.
Attend as a regular student. So I have to drop my kid there. If I don't punch, I will be counted absent. So I had to be sharp at 8:15 there in my college.
75% of attendance
yes,
is mandatory.
Otherwise you can't attend the exam. Yeah. So I was with full term pregnancy also. I was the first one to finish my thesis also. Then
may I know what was your percentage of attendance then?
Oh, it's correct. I have reached correct exact requirement.
75% you have got?
I have required. That during my delivery time, actually, yes, we are allowed to take our maternity leave, but then I would be delayed for 6 months.
Okay, basically
I can't give my final exams with the regular batch. Instead, I have to delay for 6 months.
Basically, when it comes to a postgraduate students or teachers or any of the employees, they usually have a 6 months of maternity leave.
We also have. Even PGs have. They have a maternity leave.
Yeah, but what you have done? Why you have not taken maternity leave?
I wanted to finish it off on time, and then but I didn't wanted to compromise my child care also. So I took my kid to I went to my HOD and asked, sir, will you allow me little breaks to feed my baby? Then sir, Biju Thomas, he was our HOD. I really don't forget his favor for lifetime. He allowed me. He gave me the permission. So I took my child to the hospital and I kept, my husband works in the same NITE University, KS Hegde Hospital. So I kept my child there and I used to, every time they used to, when my baby gets up, maid gives me the ring. Then I used to run, go, feed my baby and come back and attend the patient. So it was like I was literally running. I wouldn't even walk because I don't want people to talk that I am taking advantage. So yes, because of giving the baby as an excuse, if I am taking the time cap, that would be not fair for others also, right? So I was running, and but I have done most number of cases, most variety of cases. I never said no to any of my patients, and even I used to skip my lunch also. But I did. I am like really happy that I got the seat in AB Shetty, and they also supported a lot. And my family, yes, my in-laws and my parents have offered me.
I will talk later regarding in-laws. Okay. Yes, ma'am. You said that you had a maid. What was her role, ma'am?
Actually, that also I didn't wanted to leave my kid on the maid's care. So since I just took the maid because my husband is also there only, so she has to just carry the baby and call me whenever she wakes up. Other works, everything is done by me only. So her job was only to hold.
So you have that, you can say that you are a proud mother of your kid, because even though when you are studying your post-graduation, you have managed your motherhood.
Oh, really? My younger one, I didn't compromise her feeding or her, even giving bath also I only did.
Okay.
So because when they need at that age, I don't want to compromise that with other excuses. And even my elder one, since I told you I have joined in playgroup, she was going to school, she had many extracurricular projects, this and all. I never missed anything.
At the end of the day, parents has to do the work.
I did everything. I had any cultural programs, dance or anything, she didn't miss anything. So I would say I don't regret it. So tomorrow I don't have that guilt feeling that I have compromised something for my kids. No, I have stood. I hope I did my best for them.
Yes. So, may I know the age difference between the first kid and the second?
It's actually 2.4 months.
Okay, 2.4 months. We can
say
2.5 years.
2.5.
So, managing 2.5 years baby and a newborn baby is very difficult. So, when the first elder one or a younger one, when they feel sick, it is very difficult you to manage. How you have done this?
Actually, once that happened, my younger one, I was breastfeeding, so I can't compromise her. And my elder one had a very high fever and she wouldn't listen to anyone. She wouldn't eat from anyone's hand. She wouldn't take medicines. And then I had to keep both of them in a different rooms because again, the younger one we can't put at risk. So again, feeding her and running, changing my dress, going to this girl, and again like that I used to run from each child. So that was one hectic this thing. And also when my younger one felt sick, I had seminars and all. With her in my lap, I did all my seminars.
Yes, when we speak about a seminars, you have to spend at least a month for writing a thesis or collecting the data and all. So, when usually the scholars, when they are working or when they are working on some of the theses or some of the dissertations and all, usually they will take time, right? So, where morning they have to attend the classes, evening time they have to sit back at home and they have to, being a married women, you have to do all the household works. Then again, being a mother, you have to take care of your 2 kids. And when you used to sleep then?
I have spent so many sleepless nights. I can't remember. Sometimes baby won't sleep. Sometimes I have a thesis work or a seminar work. And when I do the seminar work in the starting stages, I didn't know how to do it also. As I told you, I got the gap in between. So I got scoldings also. at college.
As
then
a regular student,
yeah,
how
yeah, as a
usually we
regular,
get
how it
scoldings, huh?
this thing. Then that day I had my breakdown actually, and that night I really wanted to cry, and I was lying down on the floor to I just need a break anta. Then I see the time on the wall, and then I was like, I don't have time to cry. I
Did you
had
get
to
any
do my
negative
seminar
thoughts
in.
during that time?
Luckily, no. I want literally, like, I don't know how I picked myself up at that time. No parents here, nobody to support, and I don't know anyone since I came that time only. No friends, nothing to share also. And if I say all these hard works to my parents or in-laws, they will feel that they will break down. So I can't say them. I didn't share anything. And then always I used to tell myself that I should not break down. I have taken this path. I chose this. No, nobody forced me. So then I have to over the responsibility. Then I have to stand up. Then I used to tell self-counseling like this only, and then stand up, then go.
Manifesting. Yes. So what are the challenges you have faced in between your studies and motherhood, and how you have overcome it?
With kids, getting time to study is also difficult, and then I had to hire full-time maids, and they were not staying at all. And once though I got a construction worker as a maid, because that broker
getting a
has
maid is a very
cheated.
difficult,
Yeah, I didn't know that she's a construction worker actually. After joining, I got to know, and she doesn't know cooking or anything. Literally, I used to do the cooking. She used to have that. So all that maid going, seminar going wrong, kids falling sick, and everything. You can't compromise anywhere.
ಎಸ್ ಮೇಡಮ್, ನೀವು ಹೇಳ್ತಾ ಇದ್ರಿ ತುಂಬ ಚಾಲೆಂಜಿಂಗ್ ಫೇಸಲ್ಲಿ ಇದ್ರಿ ನೀವು. ಇಲ್ಲಿ ಕೆಲಸ ಕೂಡ ಮಾಡಬೇಕು, ಕಾಲೇಜಿದು ಕೆಲಸ ಕೂಡ ಮಾಡಬೇಕು ಆ್ಯಸ್ ಅ ಸ್ಟೂಡೆಂಟ್. ಅದ್ರ ಜೊತೆಗೆ ಮದರ್ಹುಡ್ಡನ್ನು ನೋಡ್ಕೊಳ್ಬೇಕಿತ್ತು. ಆಮೇಲೆ ಮೇಡ್, ನಿಮಗೆ ಸರಿಯಾದ ಮೇಡ್ ಸಿಗದೇ ಇರುವಂತಹ ಕಾರಣದಿಂದ ನೀವೊಂದು ಕನ್ಸ್ಟ್ರಕ್ಷನ್ ವರ್ಕಲ್ಲಿ ಇದ್ದಂತಹ ಒಂದು ಲೇಡಿಯನ್ನು ನೀವು ಅಲ್ಲಿ ಹೈರ್ ಮಾಡಿಕೊಂಡು ಮಗುವನ್ನು ನೋಡಲಿಕ್ಕೆ ಹೇಳ್ತಾ ಇದ್ರಿ ಅಂತ ಹೇಳಿಕೊಂಡು, ಈ ಟೈಮಲ್ಲಿ ನಿಮಗೆ ಅನಿಸ್ಲಿಲ್ವಾ ನಾನು ನನ್ನ ಪೇರೆಂಟ್ಸನ್ನು ಕರಿಬಹುದು ಅಥವಾ ನನ್ನ ಇನ್ಲಾಸನ್ನು ಕರಿಬಹುದಿತ್ತು ಅಂತ ಹೇಳಿ?
Actually, my in-laws and family have offered me that they will take the baby with them and I can continue my studies. But I didn't agree. So that's why I can't complain also that now it is difficult, I can't do this, that and all. Nothing. Because I was the one who chose like that. I must say they supported me a lot actually.
But you don't wanted to separate your kid from you during
like
that time,
I could, but then if I choose like that, when they need me at that time only, now when they are grown up, they don't need me much. Correct? When they are very young, I have to stand for them, I have to do things, otherwise I would miss their childhood. Because PG is not for 6 months or something, right? 3 years. 3 years if I leave my babies there.
Once she grown up?
Over, what is it? But I really feel happy that I chose like that, Once PG is done, kids are little grown up, I have my time. And now we have that bonding. Now everything they look up to me. So
As you said, your first kid is 2.5 years older than the second one. How she is taking care of her little sister?
Luckily they were not fighting. She used to play with her. They both used to have a good time. And I don't know how, maybe I'm blessed or something like that, but they never troubled me. Both of them. And when I used to study, I used to coop up in room. My younger one used to come and disturb. She used to peek and go. Then she used to say, "Excuse me." I used to burst out laughing, but then they never troubled me much. Both kids were very understanding. Even now they are at home alone, but they are like, "Get ready like this, mama, get ready like that, mama, all the best, mama," like that.
Yes, ma'am. And in regarding your clinic, that is oral dental clinic, which is
Orange.
situated. Sorry. Yes, madam. In terms of your clinic, that is Orange Dental Clinic, which is situated in KULASHEKARA, can you tell something about the clinic, what and all facilities you are having, and you are specialized in what exactly, in which fields and all?
See, first actually immediately after PG, I have worked in 2-3 dental clinics as a consultant. Then I did lot of observation because ultimately what I wanted to do is open my clinic. I am very passionate about treating patients. So only I didn't choose college jobs or anything. So I have.
So you are eligible for an assistant professor also.
Yeah. I have a qualification, but then like I wanted to treat patients. So in college you will be more like teaching others rather than treating patient. So then that's why I chose clinic only.
To give service to the society.
Yes. Then I have after 1 year working everywhere and being observed, I opened my clinic, Orange Dental Clinic in KULASHEKARA. Then so what and all I have observed is first kid when mother gets treatment, kids roaming around there only, touching all the spittoons and all that kid, and mother won't observe that, right? She is getting the treatment done. So again, kid is exposed to all kinds of infections. Dental clinic, no. So I put a special kids play area for kids. So now kids won't trouble moms. They will play, and the mom with peace she can get her treatment done and go. And also I bought this.
Being a mother, you understood that what and all the distractions are there, right? So that you have started your own in a clinic. It may not be for kids, it for adults. But still you have started one.
No, that's true, because the thing is, I always count like this. Suppose if I'm going to other clinic, how I wanted to be treated. That even my attender, I tell like that only. If you go to other dental clinic, if they put not sufficiently cleaned instruments and all, she will not accept it, right? So I tell her that only. So that clean it should be on the instruments and all. I don't accept any compromise in cleaning, all that. And also I bought this protection aprons and all, where X-ray can be taken with utmost safety. Okay, even pregnant lady, if suppose very emergency is there, we have to take an X-ray, still she can wear a lead apron and then take an X-ray. Okay, even X-ray also I bought a high-end machine where even in an open area, it won't be harmful, like that. Then to thyroid patients, lead collar is there, all that.
So these are the special
yes, safety equipments and all safety. Okay, even instruments undergo 3 stages of cleaning and autoclave, and then they will be stored in UV light, all that. So yeah, if you come to Orange Dental Clinic, you will not have any issues regarding cleanliness or safety measures. Everything is followed.
Yes, what is the operational time, ma'am?
Yeah, like morning 10 o'clock to 1:30, 4:30 to evening 7:30.
Yes. So usually when it comes to a clinics, basically the clinic will be open in the evening time.
Yes.
But very rarely. And
that is advantage of our clinic is that morning to evening it is available.
So that patients can come anytime.
They can take appointments at their own convenience.
Yes, so that morning 10 o'clock to till noon they can visit your Orange
correct
clinic, and you can have a treatment over there. Yes, when we speak about your student life and your motherhood, for whom would you like to give thanks?
Everyone.
Yeah.
First, I would say my family, my in-laws and my parents equally, and then because actually my husband. Without his support, it wouldn't. My husband is an oncologist. He is working in Kshema. So because of actually, he did his PG in KMC. So after marrying, because of him only I have come to Mangalore. So whatever I am today, I would say actually it is because of my mom and my husband. They discipline me. Then they also throw challenges at me.
So what was his response when you got to know that, okay, it's a positive?
It's up to you. Anything he says, it's up to you. So I don't want to drop the PG. I don't want to compromise the child also. I told him. He was like, okay. He didn't. I actually thought he would protest to that idea because he actually doesn't prefer crossing the comfort zone. So I thought he will protest something, and then I was prepared to convince in a different angles and all, but nothing. He told okay. Then because see, he only has to accept that I have to carry baby to the hospital. If he opposes that idea, I wouldn't have been able to finish my PG on time along with the baby. So his support is there. My in-laws and parents have supported me in like anything, and my mom has come during my final exams and she stayed with me, and my kids. Without their support, I wouldn't have finished.
Yes, in terms of your dental services in your clinic, may I know what and all kinds of services you are having?
Yes, actually all advanced services. You name implants, we have implants, and I have done 3 different courses in implants in Shet only. Okay, so I am a qualified doctor in implants. Implants are something to replace your missing teeth. Okay, and then again I am gum surgery specialist. So all things related to gums and everything I will solve it. And then I have done a course in root canal. So root canals and everything will be done, and actually the caps and all we put with warranty. 10 years of warranty we are giving with the card. So Orange Dental Clinic, you can say, is accountable. So anything you can come back and ask us.
And your clinic, how does it engage the local community?
How actually all the doctors can communicate in all languages, Kannada, Malayalam, Tulu, and we have kids play area, so that all kids can engage themselves, so and parents can
get their
and
kids also,
we have
yeah.
kids specialist also.
So what and all specialized treatments you are taking, like
Braces we have in that also.
Orthodontist is there,
Yes, orthodontist is there. He is qualified in Invisalign braces. Okay, so all the advanced treatments, as I told you, Invisalign braces, he is qualified and certified doctor. And then we have a surgeon, oral maxillofacial surgeon. Dr. Padmaraj Hegde is the oral maxillofacial. He is currently HOD of AB Shetty. And then our orthodontist is Dr. Nitin from KMC. Okay, so all the doctors, whoever is working, are extremely qualified.
yes, your clinic, that is Orange Dental Clinic, how it has helped to the local community, ma'am?
Yeah, actually I conduct lot of free health checkup camps, dental camps in different schools and in different, as I say, organizations. Under Lions Club also I have conducted some, and I have like a couple of schools like Shakti School, Sacred Heart School, all those schools free. Yeah, I take a little bit like 10 minutes of lecture for them, so that next generation they can do the prevention rather than treatment. So I take those classes and then do the checkup for them. So all the dental camps are conducted free only. Till now, since 7 years, I have conducted more than 50 camps.
ಎಸ್ ವೀಕ್ಷಕರೇ, ಕನಸು ಇದ್ದರೆ ಅದನ್ನು ನಾವು ಯಾವತ್ತೂ ಕೂಡ ನನಸಾಗಿಸಲಿಕ್ಕೆ ಪ್ರಯತ್ನ ಪಡಬೇಕು. ಅದೇ ರೀತಿ ಅವಕಾಶ ಸಿಕ್ಕಾಗ ಆ ಒಂದು ಅವಕಾಶವನ್ನು ನಾವು ಪಡೆದೇ ತೀರಬೇಕು ಅಂತ ಹೇಳುವಂತಹ ಮಾತನ್ನು ಡಾಕ್ಟರ್ ಸ್ವಾತಿ ಅವರು ನಮ್ಮ ಜೊತೆ ಹಂಚಿಕೊಂಡ್ರು. ಅವರು ಮದರ್ಹುಡ್ಡಲ್ಲಿ ಆಗಿರುವಂತಹ ಒಂದಷ್ಟು ಕಷ್ಟದ ವಿಷಯಗಳನ್ನು, ಕಷ್ಟದ ಸನ್ನಿವೇಶಗಳನ್ನು ಅವರು ನಮ್ಮ ಜೊತೆ ಹಂಚಿಕೊಂಡ್ರು. ಇದರಿಂದ ತುಂಬ ವಿಷಯಗಳನ್ನು ನಾವು ಕೂಡ ಕಲಿಯೋದಿದೆ. ನಮ್ಗೆ ಯಾವುದಾದ್ರೂ ಒಂದು ಕೆಲಸ ಆಗಬೇಕು ಅಂತ ಹೇಳುವಾಗ ಒಂದಷ್ಟು ಕಷ್ಟಗಳು ಬರ್ತವೆ. ಅವುಗಳನ್ನು ಎದುರಿಸುವಂತಹ ಸಾಮರ್ಥ್ಯ ನಮಗೆ ಇದ್ದರೆ ಯಾವತ್ತೂ ಕೂಡ ನಾವು ನಮ್ಮ ಕನಸನ್ನು ಯಾವತ್ತೂ ಕೂಡ ಬಿಟ್ಟು ಕೊಡದ ಹಾಗೆ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳಿ ಮೇಡಮ್ ಅವರು ಹೇಳಿದರು. ಎಸ್ ಮೇಡಮ್, ಇಷ್ಟೊತ್ತು ನಮ್ಮ ಜೊತೆ ಇದ್ದು ನಿಮ್ಮ ಅನುಭವಗಳನ್ನು ನಮ್ಮ ಜೊತೆ ಶೇರ್ ಮಾಡಿದ್ದಕ್ಕೆ ಧನ್ಯವಾದಗಳು ಮ್ಯಾಮ್. ಎಸ್ ವೀಕ್ಷಕರೇ, ಇವೆಷ್ಟು V4 ನ್ಯೂಸ್ ಮತ್ತು SL ಶೇಟ್ ಜುವೆಲ್ಲರ್ಸ್ ಆ್ಯಂಡ್ ಡೈಮಂಡ್ ಹೌಸ್ ಪ್ರಸ್ತುತಪಡಿಸುವ ಬಿಯಾಂಡ್ ಲಿಮಿಟ್ ವಿಮೆನ್ ರೀಡಿಫೈನಿಂಗ್ ಸಕ್ಸಸ್ ಕಾರ್ಯಕ್ರಮ. ಮುಂದಿನ ವಾರ ಇನ್ನೊಂದು ಅತಿಥಿ ಜೊತೆ ನಾನು ನಿಮ್ಮನ್ನು ಭೇಟಿಯಾಗ್ತೀನಿ. ಅಲ್ಲಿ ತನಕ ನೋಡ್ತಾ ಇರಿ V4 ನ್ಯೂಸ್, ಮುನ್ನುಡಿ ಮುನ್ನಡಿಗಾಗಿ.
SL Shade Jewelers and Diamond House, Beyond Limits. Women redefining success.